Hi, I'm Dr. Vimal, consultant pediatrician neonatologist at Cloudnine Hospital, Varthur, Bangalore. Patent ductus arteriosus. It's an abnormal connection between the two large blood vessels coming out from the baby's heart. Now, this connection is something which is normal for babies to have while the baby is in the mother's womb. This normally closes soon after birth. A temporary closure happens as early as 12 to 24 hours and a permanent closure might take about 2 to 3 weeks. When this connection is open, it causes additional pressure on the baby's heart and symptoms. Common causes of patent ductus arteriosus are prematurity. Infection during pregnancy, something called a rubella in mother, can cause a PDA in the baby, and genetical conditions. Complications because of PDA. Complications can be divided into two categories, one in preterm babies and one with other babies or an older child. In preterm babies, a PDA can cause a fast heart rate, a low blood pressure, oxygen dependency, a brain bleed called intraventricular haemorrhage, or an infection in the intestines called necrotising enterocolitis. In older babies, the presentation is slightly different, where they end up with right heart failure, a condition called pulmonary hypertension, wherein there is increased blood pressure within the baby's lung vessels, or it can result in an infection in the inner heart lining of the heart called endocarditis. How is PDA diagnosed? PDA is diagnosed using an X-ray, ECG, and the convincing diagnosis of a PDA happens via an echo, which is a bedside investigation done and will confirm a diagnosis of PDA. Treatment of a PDA. Treatment again varies. In the short term, in a preterm baby, it will entail fluid restriction, medicines to make the baby wee and sort of pass out more urine, and medications called NSAIDs. These are medications which will help close that ductus in a preterm baby only. In older kids or a term baby, these medicines may not be effective. In these babies, the only approach is a surgical closure if they are still persistent. Normally, a surgical closure will entail a catheter which is inserted in the groin and it is threaded up to the PDA, and then within the ductus arteriosus, a coil or an occlusion device is placed. If the PDA is large, then these devices again may not work and it will require a direct surgical approach where there is an incision made on the chest and a PDA is visualized and directly ligated from the outside. Timing of the PDA closure. If the baby is asymptomatic, it is generally done once the baby is around 10 kgs between 6 to 12 months of age, and a baby who is symptomatic with PDA will have to be probably operated less than 6 months of age.